Dental implants have been in dentistry since 1965. So for most people, sometimes when we present that option to them, they almost feel like it's like this new thing that we have in dentistry. So that's not the case. They are very well studied and researched and have shown to work really, really well as a tooth replacement option. So why would someone need a dental implant? Dental implant is basically a replacement of the root form of the tooth. So teeth have roots, they're embedded in bone, and then they have a crown, which is on top, something that you see in the mouth. So when the tooth is extracted, like it's lost for whatever reason, for traumatic reason, for decay reason, for gum disease reason, it just needs to be removed for whatever reason, then the best way to replace the tooth is through a dental implant, which is placing a titanium rod essentially in the bone, and then the crown gets built on top of that. The way that we do that in Inspire Smiles is by working with a board-certified periodontist. There are two parts to a dental implant. One is the surgical part of actually placing the titanium rod, and the second part is myself, Dr. Elona, actually building the crown on top of that. And I am great at a lot of things, but I'm not great at all of them. So to be able to provide the most advanced clinical outcome that's most predictable is to actually work with a specialist in the field of surgery, which would be a periodontist, to place the actual implant. With that, Eric. Eric is a 22-year-old, and he recently had a fight at school, and he got hit in the mouth, and he came in, and basically we had to remove the tooth. So the benefit of not only having a periodontist to be able to provide the most advanced clinical outcome, but actually a periodontist within our practice who partners with me to be able to restore the tooth, is for us to be able to do that a lot faster than it would ordinarily take. So he was able to come in, we were able to extract the tooth, bone graft, which is actually strengthening the bone, and then allowing everything to heal, place the implant, and now we're ready to place the crown. So the best way to replace the tooth is not to just place, either leave it open or place a bridge sometimes is another option, but not having the actual root in the bone would make the bone go away, so that we only have bone in our jaws to actually support the roots of the teeth. And the best way and the only way actually to do that is to place the root back artificially, in a sense, through a titanium root form, which is called an implant, and build a crown on top of that. So with Eric and Inspire Smiles, because we have a multidisciplinary team here, put together by me and all directed by me, and we know that things are going in the right direction and getting completed correctly, with a periodontist on site, we're able to do this quickly, elegantly, and provide the most ideal outcome for a patient like you. So if you need a dental implant, we are most definitely more than able to provide that service in a high quality manner and with the best patient experience.
Awesome.
Good?
Yeah.